crash course on your health, not just women's health, but yours, you know? Okay? So, how are you guys, how familiar are you guys with your own health in terms of your sexual organs? On a scale of 1 to 10, how familiar do you feel with it?
Say 7.
Yeah,
Yeah.
5, 6, 7.
Okay. Okay. And so have you guys heard of pap smears?
Yes.
And how many of you guys have actually gotten one? Or at an age where you should get one and haven't gotten one?
I haven't.
Okay. And do you guys know what they're for?
Yes.
Okay.
No.
Can you go ahead and change the slide?
Ignore Brianna's voice.
Is that too many?
No, that's it. Okay, what questions have you always wanted to ask regarding pap smears?
Do they hurt?
Do they hurt? Okay, any other questions?
Like, what
I'll answer
exactly do they do?
What exactly are they
Like-
doing?
Mm-hmm.
Okay. And is that basically it?
How long does it usually take for
Okay.
like a one session or whatever checkup, I guess you call it?
Okay. So to answer your questions, pap smears do not typically cause pain, but then again, the experience can vary among women. So most likely you'll feel pressure, and so what they're doing is that they're inserting a speculum, and this speculum is meant to open the vaginal canal. And go ahead and change the slide. So the speculum goes in here into the vaginal canal, and basically where they're taking a sample from are your cervical cells, and it's right here by your cervix. So the speculum will go in here, it'll open it, and they'll scrape cells right there. And so basically they're trying to find for any abnormalities, like things that would cause cancer. And you guys know what typically leads to cervical cancer. Yeah, you guys have an idea?
What's like the result of a cervical cancer?
Or what are the risk factors? How does one get cervical cancer?
Usually isn't it like genetics?
Yeah, genetics play a role.
Yeah.
Bad hygiene. Can that have something to do with anything? Like,
No, not typically.
okay, I don't
Or
know.
is it
Like really bad hygiene? Like,
Is it from like, I don't know, intercourse?
Yeah, so
Yes,
intercourse can be a really high risk, especially if you've had multiple sex partners, because that introduces a larger risk of contracting STDs. And so a certain STD that can lead to cervical cancer is called human papillomavirus, or otherwise known as genital warts. And believe it or not, it's actually more common than most people would like to believe. So when one becomes infected with human papillomavirus, not all of the strains cause cancer, but about 13 of them do. Okay, and do you guys know about the Gardasil vaccine?
Nope.
No, have you guys gotten it when you guys were 12 years old?
I don't
Probably.
know.
Maybe
I've
a
heard about
three-course
it.
shot?
But
Okay.
I didn't get it.
So Gardasil is a human papillomavirus or HPV vaccine that you're given at starting 12 years old or higher. Basically, it prevents you getting the strain of human papillomavirus that could cause cervical cancer. So since the release of that vaccine, the rates of cervical cancer have gone down. So it's never too late to get it if you do decide to get it. And yeah, you
Actually, I
guys-
think I might have gotten it.
Yeah, like I think it's required.
Because like literally, I was like,
Yeah,
why
it's
do I
highly
need this?
recommended.
If I'm like, I don't know, in 7th grade.
Oh, I
Like,
see.
I'm like, I'm not doing
That's-
anything. Anyways.
Yeah, those are like.
yeah, basically it's a 3-course vaccine, so you get it a few months apart every shot. And it's for men too, because men can also contract human papillomavirus. Human papillomavirus is asymptomatic, and by the time you actually start to get symptoms, it's because the infection has become severe enough. So, yeah, basically that's what they're testing for, cervical cancer. Pap smears, does it hurt? The experience varies. You will feel pressure just because of it'll feel kind of strange having something opened up. The scraping, you might not feel that, you might, but again, the experience varies by women. And what was that third question that somebody asked? How long does it take, right?
Uh-huh.
Okay, so a pap smear The time can vary, but shouldn't take longer than about 20 minutes.
Okay.
Mm-hmm.
That's good.
So basically, you'll be instructed by the nurse or the gynecologist or the NP, whoever your healthcare provider is. They'll just instruct you to lay down. They're going to walk you through the procedure, explain it to you. They'll insert the speculum, take the scrape of cells, and basically that's it. But
I see.
So, any other questions regarding this?
So how far up does the thing go again? The like pap smear test?
The speculum
Yes.
only goes as far up as just to open your vaginal canal and so they can
Okay.
get to your cervix.
Okay.
Nothing goes
That's pretty deep though still.
in your
Right?
uterus. It's in your vagina.
Okay.
So
Is it kind of like those things when you go to the dentist and they have to prop your like mouth open? Is it kind of like that but for down there?
So an
the
interesting
speculum
analogy.
is more like it's more like
Oh, it's
kinda
more like a
shape like
clamp?
this. Yes, it's more like a clamp, and then it's kind of like open, so it kind of.
Oh, I see.
Do you know what I mean?
Okay,
So it's
gotcha.
already come open, and then they just kind of crank it open. So
I
it just kind
see.
of
I see.
opens up the vaginal canal. I
Okay.
can show you guys a picture of one later.
Okay.
Any other questions? Feel good about it?
Yep.
Okay, awesome. Okay, so then the next one, you can change the slide, is breast exams. Breast self-exam. So you're never too young to start. This one will just be a little quicker, but how many of you guys actually do a breast self-exam?
A self?
Breast self-exam, yeah.
Is it the one where you kind of check for like lumps? And like for example, if you like you grab your boob, there's like the hard part in the center. I think that's where the milk sac is, right?
The milk ducts.
Yeah, so that's supposed to feel hard, but everything else, if there's a lump, that might be like a normality, I guess, right?
Yeah, so.
And also like red spots or something like that,
Yeah.
like weird red spots. That's like not acne.
So like rashes or anything
Yeah.
like that. So a breast self-exam is recommended about once a month, about a week after you're done with your period. You usually want to try to avoid it around that time, just because during your period you can get like, it can become a little lumpy, it can become very tender, so probably not the best time to do a self-exam. So wait about a week after you've had it and kind of go methodically, kind of start from the center, move your way out, and just kind of start examining for any abnormal lumps. If, I guess, concerning stuff would be something more like how you said, rashes or red spots, indents, and hard movable lumps, especially under your underarm. Hard unmovable lumps. So if it's very fixed, if it's kind of hard, you feel it anywhere, and you feel like you can't really move it, it's maybe not a cause for alarm, but worth mentioning to your doctor.
I see.
And of course, it's normal to have lumps here and there in your breast, but if you just kind of wait them out, if you bring them up to the attention of your doctor, they can let you know if those are normal or abnormal. But so basically, this kind of helps you gauge what is the normal for you. So maybe there's a lump there and it's movable and it's fine and it comes and it goes, but it might just be normal for you. But what breast self-exams do is that they help you detect something is if something pops up and it's abnormal. So if you have a hard lump there or a weird rash there that wasn't there previously, then that's something worth mentioning to your doctor.
I see.
Any questions regarding that? Okay. Well, yeah, that was it.
Wow.
You guys feel pretty good. How do you guys feel like you know about this stuff? On a scale of 1 to 10, how familiar do you guys feel with your own?
Definitely more up to like the 9 to 8, 9, 10.
Yeah.
Okay,
For sure.
awesome.
Yeah,
That's good
I
to
feel like
know.
I know a lot more about like the signs to be looking for and what to expect. So
Yeah.
Okay.
I had no idea what to expect before. So
Great.
Oh, I do have one question.
Oh,
So
go for
after
it.
because it's 21 where you're supposed to get like your first pap smear, right?
Yes.
After you get your first one, how frequently should you get pap smears? Is it like once every 10 years then?
Every 3 years.
Every 3, okay.
Every 3 years, starting from 21 to 65, you should have a pap smear every 3 years, unless you have another agreement with your doctor to do an HPV test instead.
Okay.
But typically every 3 years up until
Okay.
30, and then it decreases to every 5 years.
I see.
What about mammograms? When should you start getting mammograms?
Mammograms start at 40 years old.
Okay.
So,
Is
but
that more for like the menopause and
I just
stuff like that?
just because of
hormones.
hormonal shifts, you might start to notice lumps, but typically breast cancer risks increase at around the 40-year mark. Mhm. So yeah. And regarding HPV, a fun fact is that by the age of 50, 4 out of 5 women will have contracted some strain of HPV. So if you ever do come across it, typically your body can fight off a regular HPV infection there, and it varies by strain. So some strains are your body can handle, some strains can be more severe. But if that ever comes, know that it's not abnormal, know that it's not something to be ashamed of, but something worth treating and worth looking into. And these things are worth talking about, so don't feel shy.
Okay. Thank you.
Awesome.